You think the Old West was brutal because of the gunfights, because of the hangings, because of the outlaws. Forget all that. The most terrifying thing you could encounter on the frontier wasn't a bandit, it was a doctor. 3 out of 4 so-called physicians west of the Mississippi had no medical degree. None. They called themselves doctors, hung a shingle on a saloon wall, and went to work with the same tools your grandfather used to shoe horses. After this video, you will never look at a bottle of medicine or a pair of pliers the same way again. Before we get into it, if you want more of these buried, forgotten, real American stories that Hollywood will never touch, hit subscribe. We drop new ones every week, and trust me, it only gets stranger from here. Number 20. You could walk into any town and call yourself a doctor. Picture this. It is 1862, and a man calling himself Dr. Hullings sets up an office in Hangtown, California. No degree, no training. His only qualification? He dressed well and drank heavily. He actually challenged a trained physician to a duel over medical turf. He lost. The trained doctor put a bullet in him and kept practicing. This was not rare. Before 1873, when Texas became the first state to require a medical license, anyone could hang a shingle and start cutting. Historians estimate only 1 in 4 frontier physicians held any medical degree at all. The other 3 learned by watching, guessing, and, when that failed, burying their mistakes quietly on the edge of town. The law that let every charlatan with pliers call himself a doctor, that was not a frontier quirk. That was the law of the land. At number 19. Mercury, the cure that rotted you alive. It is 1850. You have syphilis, cholera, typhoid fever, or just a bad cough. The doctor nods gravely and hands you calomel, mercury chloride, a powder considered the Swiss Army knife of 19th century medicine. It was prescribed for everything from diarrhea to skin disease to fevers. Here is what nobody told you. Doctors administered it until you started to drool uncontrollably. That was the sign it was working. What it actually meant was mercury poisoning. Your teeth came loose. Your gums blackened and receded. Your bones began to deteriorate. One 20-year-old soldier named Carlton Bergen was given calomel for pneumonia in 1862. The mercury ate through his upper palate, his right cheek, and destroyed his right eye. He became one of the first people in American history to require reconstructive plastic surgery, just to have a face again. Scientists can still identify Lewis and Clark's campsites today by measuring mercury levels in the soil left behind by their medicine chest. At number 18, the jugular bleed, when draining you dry was the diagnosis. Bloodletting had already been killing people for 3,000 years when the Old West rolled around. But frontier doctors took it somewhere new. Dr. Daniel Drake, founder of Ohio's first medical college, published a guide in 1832 advising physicians to bleed patients even if the pulse was nearly imperceptible. And if a lancet to the forearm was not doing the trick, cut the jugular. This was not fringe medicine, it was standard practice. Patients were bled until they fainted, about 20 ounces of blood, sometimes more. George Washington had roughly 40% of his blood removed in a single 8-hour session trying to treat a throat infection. He was dead the next morning. Some frontier doctors bled patients up to a pint per day. The irony is savage. Weakened, anemic patients were easier to manage, easier to keep still. The doctor got to look like he was doing something. The patient just had to survive it. Bleed, blister, and purge was the actual medical mantra of the era. It was not a metaphor. It was the prescription. At number 17, tobacco smoke enemas, a real medical procedure. We are not making this up. Throughout the late 1700s and into the 19th century, right through the frontier era, one of the established medical treatments for drowning victims, cholera, constipation, headaches, and hernias, was a tobacco smoke enema. Using a bellows device, a physician would force tobacco smoke into the patient's rectum. By the turn of the 1800s, the Royal Humane Society considered it as important as artificial respiration. Resuscitation kits were installed along the River Thames, with smoke enema equipment included. Doctors used it on cholera patients during the stage of collapse. It was a known hazard that if you accidentally inhaled instead of blew, you could pull cholera directly into your lungs and die. The practice only fell out of fashion when scientists discovered that nicotine was poisonous. The treatment was killing the patients before the disease could. At number 16, blistering. Burning the sick to make them well. After bleeding came blistering. If draining your blood did not break the fever, the next step was peeling your skin. Literally. Doctors applied cantharides, secretions from the Spanish fly beetle, or mustard plasters to cause enormous blisters. Some wrapped cotton around limbs and set it on fire. The theory was that illness was caused by noxious humours inside the body. By creating open, weeping blisters on the skin, you gave those humours a way out. The practice was called counter-irritation, because the new wound supposedly distracted the body from the original illness. It created open wounds with no sterile dressing in an era with no germ theory. The result was infection, sepsis, and, frequently, death from the cure rather than the disease. When your doctor's toolbox includes fire and beetle venom, the patient's best prayer is a quick death. At number 15, amputation in under 10 minutes. Speed was the skill. After the Civil War, battle-hardened surgeons flooded west, and they brought one trick with them: speed. A skilled battlefield surgeon could amputate a leg in under 10 minutes. The best could do it in 2. That was not bragging, it was survival. Without germ theory, every minute the wound was open was another minute infection could set in. In frontier towns, the scene was almost identical. Gunshot wound? Crush injury from a mine? Infected limb turning black with gangrene? The answer was almost always the same: take it off. About 75% of all Civil War-era surgeries were amputations, roughly 60,000 operations. The hip amputation mortality rate was 83%. But leave the limb on? Hospital gangrene had a 90% mortality rate once it took hold. You could watch the black rot spread, inch by inch, across your patient's body. The saw was mercy. General Sickles visited his own amputated leg, on display in an army museum, every year on the anniversary of its removal. At number 14, Laudanum, the legal drug destroying families from the inside. Laudanum was the frontier's answer to everything. Headache? Laudanum. Toothache? Laudanum. Childbirth? Laudanum. Baby will not stop crying? Spoon-feed the infant laudanum and get some sleep. It was legal, unregulated, sold without a prescription, and handed to women and children with the casual confidence of handing out aspirin. Laudanum was roughly 10% powdered opium dissolved in alcohol, up to 50% pure spirits. It was the most addictive substance most people on the frontier had ever encountered, and they had no idea. It was marketed specifically to women for female complaints: menstruation, menopause, hysteria. Girls as young as 14 were prescribed it. Frontier prostitutes used it to commit suicide. Mattie Blaylock, Wyatt Earp's common-law wife, became addicted to it. By the time the government started regulating opiates in 1914, an entire generation of frontier women had been made addicts by their own doctors. The American government distributed 10 million opium pills to soldiers during the Civil War. The opioid crisis did not start in a pill factory. It started with a prescription. At number 13, the janitor who performed the West's first Caesarean section. In 1827, a woman in Ohio was desperate. Her labour had stalled, her baby could not come. The doctor who arrived, a man named John Richmond, had never performed or witnessed a Caesarean section in his life. He had learned medicine by listening through the walls of a medical school while working as a janitor. He operated anyway, by flickering candlelight, in a farmhouse, without anaesthesia. The woman begged him to stop. She screamed through the entire procedure. The baby did not survive, but the mother did, making it possibly the first successful Caesarean section in the American West. At that time, the operation was fatal to 3 out of 4 women, even in the best hospital conditions. Richmond's survival rate was 100%, by luck, improvisation, and sheer willpower. He had no credentials. He had no training. He had a knife, a candle, and nothing left to lose. The same system that let him operate also let the quacks operate. There was no way to tell them apart until someone died. At number 12, Native American healers knew more and were ignored. Here is the thing that never makes it into the history books. While frontier quacks were poisoning patients with mercury and blister beetles, Native American healers had developed sophisticated, effective botanical medicine over thousands of years. Willow bark, containing salicylate, the precursor to aspirin, echinacea for immune response, wound cleaning techniques using plants with genuine antiseptic properties, specific herbs, roots and preparations that treated fever, infection and pain with real, measurable results. American frontier physicians, many of them working under the same racist government policies that were forcibly removing native peoples from their land, dismissed this medical tradition as primitive, superstition, savagery. But frontier women knew better. Historical records show they routinely used home remedy traditions influenced heavily by indigenous knowledge, because anything but the doctor was often the wiser choice. The men with the degrees were the dangerous ones. The same government that called native medicine superstition was the one handing out mercury pills as cures. Funny how that works. At number 11, frontier dentistry, pliers, blacksmiths, and broken jaws. Only 3 dental schools existed in the entire United States at the end of the Civil War. Out west, if your tooth was rotting through your jaw, your options were the doctor, the barber, or the blacksmith. All 3 used the same tool: pliers. There was no anaesthesia for early frontier extractions, just alcohol. Patients were held down. The plier grip technique worked by anchoring against the jaw for leverage, which frequently meant the jaw itself cracked under the force. It was not unusual for a botched extraction to leave the patient worse off than before. The average frontier citizen was completely toothless by age 50. Outlaw Clay Allison had a dentist drill the wrong tooth, left to find a second doctor to fix it, then returned to the original dentist and ripped out one of his teeth with pliers as payment. By the late 1800s, cocaine became the miracle painkiller for dental work. Progress. except now your dentist was also your drug dealer. At number 10, cocaine drops for children, the legal kind. Picture a mother in 1885 standing at the pharmacy counter. Her child has a toothache. The pharmacist hands her a small brown bottle. Lloyd Manufacturing's cocaine toothache drops, 15 cents. Instantaneous cure, says the label. This was not a back alley transaction. It was sold openly at every drugstore in America. Cocaine was legal until 1914, prescribed freely by doctors for hay fever, throat pain, headaches, and surgical anesthesia. Mrs. Winslow's soothing syrup, marketed for teething babies, contained morphine. One company sold heroin tablets for asthma. A Belgian firm sold cocaine throat lozenges, described as indispensable for singers, teachers, and orators. By 1900, the patent medicine industry was an $80 million business, the equivalent of nearly $3 billion today. The entire industry ran on getting customers addicted and calling it medicine. Coca-Cola's original 1886 formula contained coca leaf extract. It was marketed as a brain tonic. You were not buying a soda, you were buying a microdose of cocaine. With bubbles. At number 9, arsenic, prescribed as a tonic for everyday health. Forget the mystery novels. In the real Old West, arsenic was not a murder weapon. It was a health supplement. Fowler's solution, a liquid arsenic preparation, was widely prescribed in the 1800s to treat fevers, skin conditions, asthma, syphilis, and as a general tonic to invigorate the blood. Doctors administered it in careful, escalating doses, the theory being that what did not kill you made you stronger. The problem: arsenic accumulates in the body. Hair loss, nerve damage, skin lesions, organ failure. Long-term arsenic poisoning mimics natural aging so closely that for decades victims appeared to simply waste away. Hair tonics of the period also contained arsenic, lead, silver nitrate, and borax. And they were wildly popular during Prohibition because they were 30% alcohol and got you reasonably drunk in the process. Long-term arsenic poisoning was called arsenical cachexia. Patients shrank, they yellowed, their bodies gave out slowly and completely, and their doctor refilled the prescription. At number 8, asthma cigarettes, smoking as prescribed therapy. If you had asthma in the late 19th century American West, your doctor might prescribe cigarettes. Specifically, Potter's asthma cigarettes, which contained a blend of herbs and narcotics, including stramonium, a hallucinogenic member of the nightshade family, and atropine, derived from belladonna. The idea was that inhaling the burning compounds would open the airways. There was a thread of logic to it. Belladonna is a bronchodilator. It can temporarily open constricted airways. But the delivery mechanism was fire and smoke, pumped directly into already damaged lungs. The addictive properties of the narcotic blend meant patients kept smoking long past any therapeutic benefit. These were not fringe products. They were advertised in mainstream medical publications, sold at reputable pharmacies and endorsed by physicians. Respiratory damage on top of respiratory illness, prescribed by the man you trusted with your life. The doctor told me to smoke is a sentence that was literally medically true in 1890 America. And somehow, it still does not feel like the craziest thing on this list. At number 7, maggots, the accidental cure that doctors tried to eliminate. Private J.P. Kegereis was shot in the neck at Petersburg, Virginia in 1864. He was tagged for amputation. He tore off the tag and crawled away. 3 days later, medics found him, alive, his wound packed with maggots. They cleaned it anyway, and he survived. What doctors did not understand: maggots eat only dead and infected tissue. They leave healthy flesh alone. Civil War surgeons actually observed that soldiers whose wounds had been colonized by maggots in the field healed better than those who had not. But it looked disgusting. It was associated with neglect. So they cleared the maggots and sewed the wounds shut, creating the perfect sealed environment for bacteria to explode. Modern wound care has rediscovered maggot therapy. Surgeons today use specially bred, sterile maggots for exactly this purpose. The primitive treatment was correct. The sophisticated one was killing people. A soldier who crawled through mud for 3 days and let flies have his wound had better medical outcomes than the man in the surgeon's tent. Medicine does not always know best. At number 6, trepanning, drilling holes in the skull on the frontier. Head wound from a gunshot or a fall? In the Old West, if you lived long enough to reach a surgeon, there was a meaningful chance he would drill a hole in your skull. Trepanning, boring into the cranium to relieve pressure from brain injury, was not some ancient lost art. It was active 19th century medicine, carried west by military surgeons who had practiced it on the Civil War battlefield. The procedure was performed with hand-cranked drills and manually operated saws on a conscious or barely sedated patient, in whatever space the doctor could find. The goal was to release pressure building up from skull fractures or internal bleeding. Sometimes it worked. More often, the open cranial wound became infected. Meningitis, brain abscess, death. But there was a grim logic to it. A sealed skull fracture with pressure buildup was nearly always fatal. Drilling gave the patient a chance. A small, terrible, brutal chance. The procedure is still used today, called a burr-hole craniotomy. The difference is a modern operating room, sterile tools, and a board-certified neurosurgeon. Not a man with a hand crank and a prayer. At number 5, the patent medicine empire. $80 million worth of lies. By 1900, the patent medicine industry was worth $80 million, the equivalent of nearly $3 billion today. And it was built entirely on lies, addiction, and desperation. At least 1,500 patent medicines were catalogued by 1858. They promised cures for cancer, tuberculosis, syphilis, gout, and female complaints. Each wagon that rolled into a frontier town was its own pharmaceutical company, its own advertising campaign, its own travelling theatre. Clark Stanley, the Rattlesnake King, travelled across the West selling snake oil liniment made from, he claimed, rattlesnake fat combined with indigenous healing knowledge. In 1916, federal inspectors finally tested it. It contained mineral oil, beef fat, red pepper, and turpentine. Not a single rattlesnake. But it sold. Because the frontier was a place of pain and very little hope. And if a smooth-talking man in a wagon told you that $1 could fix your suffering, you believed him. You needed to believe him. Some of those medicines did contain opiates and cocaine, which technically did relieve pain. They just also created addicts, which meant repeat customers. The business model was perfect. At number 4, radium water, drinking radioactive poison as a health tonic. It is 1927. Eben Byers is a wealthy socialite, an amateur golf champion, a man of taste and prominence. He injures his arm on a train. His doctor prescribes Radithor, a patent medicine containing actual, measurable quantities of radium dissolved in distilled water. The label promises it will restore vitality and cure chronic conditions. Byers drinks it every day. For years. By 1931, his jaw has fallen off. His skull is collapsing. His bones are spontaneously fracturing. His body, riddled with radiation-induced cancer, is being eaten from the inside out. He is buried in a lead coffin because his remains are still dangerously radioactive. The Wall Street Journal headline reads, "The radium water worked fine until his jaw came off." Radithor's creator, self-proclaimed Dr. William Bailey, had previously sold strychnine as an aphrodisiac. He died in 1949, also of radiation poisoning from his own product. Radithor was sold at pharmacies by a man who was not a doctor, regulated by no one, until the jaw came off. But number 3, surgery without washing your hands, and why it took a generation to change. In 1846, Hungarian physician Ignaz Semmelweis proved that doctors were killing their own patients by not washing their hands. The death rate in maternity wards dropped from 18% to 2% when doctors simply cleaned up before delivering babies. He presented the data. He showed the math. He begged the medical establishment to listen. They laughed at him. He died in a psychiatric institution in 1865, likely beaten by guards, almost certainly from the very infection he had spent his life trying to prevent. By the time frontier surgeons in the 1870s were still probing wounds with unwashed fingers, moving between patients, between amputations, between the dead and the living without cleaning anything, Semmelweis had already shown them the answer. They simply refused to believe it. The arrogance of the medical establishment killed more people than the ignorance. Medicine knew how to stop the dying. It chose not to. Semmelweis was right. He was committed anyway. The man who could have saved thousands was locked away for saying so out loud. At number 2, the bone saw, the screaming table, and 60,000 amputations. By the time the Civil War ended, military surgeons had performed roughly 60,000 amputations. The saw was the defining tool of the era, and those surgeons brought their habits west, into mining camps, frontier towns, and army forts, where the nearest real hospital could be a week's ride away. Without anaesthesia beyond whiskey and a rag to bite, patients were strapped to tables and told to hold still. The screaming was so constant in field hospitals that soldiers outside began calling them butcher shops. One military study found that patients who refused amputation and kept infected limbs survived at lower rates than those who submitted to the saw. The surgery was agony. The alternative was a slower, quieter, equally certain death. Surgeons were not sadists. They were pragmatists, working at the edge of what was survivable, with no antibiotics, no sterile field, no blood transfusions, and no second chances. They saved lives the only way they knew how, and they left behind a generation of men with one arm, one leg, and a very particular understanding of what mercy actually costs. And at number 1, the operation with a 300% fatality rate. We save the worst for last, because this one defies belief. In the 1840s, the fastest surgeon in England performed what became the only operation in recorded history with a 300% mortality rate. He amputated a leg in 2.5 minutes, with hand tools, no anaesthesia, a patient strapped screaming to the table. In his speed, the saw also severed 2 fingers of his assistant. Both wounds became infected. Both the patient and the assistant died of gangrene. An observing physician standing nearby, watching the flashing blade, felt the coat brush against his skin and collapsed in terror, convinced he had been cut. He died of shock before they could examine him. 3 deaths, 1 operation. In the frontier West, scenes like this happened in saloon backrooms, in mining shacks, under lantern light, with the nearest real hospital a week's ride away. Speed was the closest thing to mercy, and sometimes mercy still was not enough. Here is what all 20 of these stories have in common. None of these doctors thought they were doing something wrong. They were working with the knowledge they had, in the system they inherited, with the tools handed down by the generation before them. The tragedy of Old West medicine is not that it was full of monsters. It is that it was full of ordinary men, some dedicated, some brilliant, many just doing their best, operating inside a system that had not caught up to the truth yet. And that should make you pause. Not because the past was uniquely broken, but because the future is looking at the present the same way we look at bloodletting and radium water and tobacco smoke enemas. Some treatment being prescribed today, some drug, some procedure, will look 100 years from now like something from a horror story. Medicine is always catching up. The question is how many people it costs to get there. Which of these 20 hit you hardest? Drop it in the comments. And if you made it this far, you are one of us. Subscribe, because next week, it only gets darker.